Okay, this lecture is on Chapter 5. This is Social Work and Mental Health. Social work and mental health, there's varying levels of licensure for your social workers. There's the Bachelor's Social Work or BSW professionals. These are those who work as case managers in a non-clinical area arena. They mental health oriented field placement, abnormal psychology elective, and practice methods courses. Your BSW or Bachelor of Social Work is going to be a general framework, and then your master's is going to be a more specialized area. A master of social work is going to be inpatient or community mental health field placement, a practicum, as we call it, or a clinical internship, curriculum concentration in mental health. And then training in individual, family, and group therapy, and then acquire clinical license credential. Master social workers do a certain amount of clinical level work and then become a LCSW in the state of Texas. So it does follow those same terminologies. LBSW, a licensed baccalaureate social worker, licensed master social worker, and then licensed clinical social worker, which is the highest level a social worker can be. All social workers will work in these 8 different areas: assessment, treatment planning, collaboration with others on a mental health team, evaluate treatment outcomes, provide access to community resources, and then also to understand social policy, cultural competence, as well as being able to do client education and educate others. A BSW is an advocate, counselor, and case manager, but they are not unless otherwise certified, allowed to do clinical work. A master social worker is a psychiatric social worker, allowed to do psychotherapy, and then also with a mastered level be able to be a clinical administrator, someone in leadership in a mental health facility. The DSM is something that's used in mental health across all areas of work, from your psychiatrist all the way to your mental health technicians. This is the classification system for mental illnesses. There are 5 elements of the system, which is the axis or the axes. Definitions are imprecise, but provides labels for disorders, not people. And then the way that you would look at this is by taking a look at the different symptoms that the person may be presenting. It's important for insurance reimbursement of services and widely used system which social workers need to be familiar with. You will see the DSM quite frequently in your work in mental health. Pharmacological interventions and widely used for Axis 1 diagnoses. You're going to work with a psychiatrist in most cases, who will be the prescribing, or an MD, prescribing doctor. Many have negative side effects which require other medications to correct. Often these medications are extremely expensive, and these are your antipsychotics and other type of medications like Antabuse, Suboxone, lithium, geodone. There's just a lot of different type of medications that can be used with Axis 1 diagnoses. It's important for the calibration of the correct dose, and it can take considerable time of adjusting medications to get them at a correct dose. Social workers assist consumers and families with monitoring medication, and then also social workers help clients integrate medication use with behavioral changes. The key here is medication with in combination with some type of therapy is going to be your best choice. Social work interventions will facilitate group therapy sessions, family therapy sessions, individual sessions, and this is the framework of any type of clinical worker, which will be mutual aid, skill development, problem solving, and self-esteem building for the client. Case management, work with consumers to monitor progress, advocate for services, and provide counseling. Community education, prevention, as well as community awareness to support mental health and prevent mental illness. illness, and then social advocacy and social change, like on chapter number 2, advocacy to meet the needs of the mentally ill and improve access to services, to make sure that if there's any place in our community where people's needs are not being met, more specifically those with a mental health illness, that social worker will be the change agent to bring about the necessary change to help them. Crisis intervention within a client's framework of treatment. A client will be having different events and different situations that occur. Client-centered and situation-focused approach to helping your clients. This allows you to attend to basic needs of victims and rescue workers, listen to personal stories, affirm emotions, encourage healing, prioritize problem solving, facilitate long-term treatment, and to resolve trauma and prevent PTSD. This is important because when you're working with clients who come from either a disaster, tornado, fire, hurricane, there are many times those with substance abuse or mental health illnesses within those disasters, and then that would be a crisis that would need to be dealt with. And social workers played a vital role in the evacuation and delivery of services from Hurricane Katrina. Mental health and social justice, and this is important for the social worker to understand the long-term impact of diagnostic labels. Before you'll have clients who walk into a facility who will say, I'm bipolar or I'm schizophrenic. Well, you want to avoid those labels for the clients because the client is a human being and deserves adequate treatment. And so if someone identifies too much with their label, then they may begin to manifest other symptoms as well. Advocate for equal access and effective mental health services for all people and promote parity between physical and mental health care. Just in 2009, the parity law was signed by Congress. Parity means that someone who has a mental health illness deserves the same treatment as someone who has a broken arm, diabetes, or cancer. Understand how the environmental context can impact mental health and empower oppressed groups to protect their living environment. And this is when we look at the environmental aspect of social work, being able to look at if someone is in a poor community, in a poor area where there's not a lot of access to education, jobs, or services, the social worker should be aware of all of those limitations that a client may have in working towards their sobriety or recovery. Mental health and cultural competence. You should be able to empower individuals, families, and communities to safeguard their way of life, develop a historical understanding of the oppression as well as the appreciation for cultural differences. You should be able to know where different ethnic and cultural groups come from and know definitely the differences between their belief systems or innate cultural things that are in place. Be conscious and appreciative of self and how this impacts the work with oppressed individuals and groups. Self-appreciation, self-awareness, and a conscious awareness of your own culture and where you come from is vital in working with any group or population. Okay, the next 4 slides are going to be a review of history. We've already really talked a lot about all this in lectures 1 and 2, so I'm really going to just read these to you so you can review them for the exam, but we looked at this already but quite a bit. In the late 1700s, physicians advocated for individualized and human treatment for the mentally ill. This is where things would lead towards deinstitutionalization. In the mid-1800s, Dorothea Dix, that's an important name to know, exposed the practice of confining the mentally ill in prison and facilitated reforms. In 1907, M.A. Cannon is the first mental health social worker. 1908, Clifford Beers wrote his personal story of inhumane treatment while being hospitalized himself. 1913, M. Jarrett is the first director of social services in a psychiatric hospital. 1917, M. Richmond defines, and that's Mary Richmond, defines social casework. 1918, Smith College offers the first training for psychiatric social work. 1920s and 30s, social work off psychotherapy. And then this is going to be where you see it begin to break off and become its own discipline. 1930s and 40s, B.C. Reynolds links practices with individuals to social action. 1930s, Taft and Robinson developed the functional school of social work, which is where our Society of Social Workers comes from. 1945, the VA is the largest employer of social workers. 1949, National Institute of Mental Health is established. 1963, community-based mental health services are prioritized. 1964, F. Hollis initiates the clinical social work movement. And then 1979, NAMI is founded. And then 1980, outreach services to the homeless and chronically and mentally ill are funded. Finally, access to mental health services. There's a need for access to universal health care, which is coming about, like I said, in Chapter 4. And then mental health parity, which I told you has already happened as of 2009. Equality of insurance benefits for physical and mental health services. Insurance-directed services, focused practice, intermittent service groups, interventions, psychoeducational approaches, and standardized protocols. Outcome-focused demonstration of goal achievement as expected. Be sure and review the history here for your first exam. I think I hit on the main important points, but there are a few names here that you need to know for the exam. So be sure and come back and review them whenever you take it. I'll see you in the next lecture.